Hello, my name is Cary Adams and I'm the CEO of the UICC, the Union for International Cancer Control, based in Geneva. I'd like to talk about our campaign that we're running over the next 3 years, which is looking to raise over $20 million to help us put into action a lot of the work that we believe needs to be put in place to address cancer around the world. But first of all, let me linger on the past. Let me talk about the last 4 years when we've been running another campaign, which is called Together We Are Stronger. And during that campaign, we brought together organisations and partners from around the world to make a difference on cancer at the global level, starting with an awful lot of advocacy. This was the first building block. This was a chance to put cancer on the global health and development agenda. And we've had great successes working with our colleagues in the NCD Alliance at putting cancer on that global health agenda. I just recall the UN summit in September 2011 when we had the NCDs outcomes document signed off by all member states around the world. And we followed up with great advocacy at the World Health Assembly, where we now have a global monitoring framework and we have targets, for example, the 25% reduction in premature deaths from NCDs and cancer by 2025. But a lot of this work has been putting the framework in place, and now we need to convert that into action. So UICC has designed a new program activity about capacity building with some advocacy as well, which we hope over the next 2 years are going to put really some meat on the bones of the issues that we face around the world on cancer. So our partners who have joined us so far will be joining us again, and we hope to include more. So I'd personally like to thank some of those organisations who have really committed, not just funding, but also committed support, resource, ideas, attended all our meetings, done advocacy with us, and really worked shoulder to shoulder to make a difference in the last 3 years, and we hope they're going to be there for the next 3. So organisations like the Dutch Cancer Society, the Norwegian Cancer Society, the Swiss Cancer League, Friends of Cancer Patients, the American Cancer Society, Livestrong, and of course Sanofi, Varian, Roche, Electa, Pfizer, Bayer, and Novartis, and there are many, many more. We have over 47 organisations at the moment who work with us on a day-to-day basis to put cancer on the global health and development agenda. So I'd like to say the next 3 years are going to be very exciting. Our plans are very simple. We will put cancer into the post-2015 development agenda. We will continue to convene the world of cancer and make a difference by exchanging best practice, for example, at our World Cancer Congress in Melbourne at the end of this year. We will also use World Cancer Day to bring the cancer community together to raise the profile of cancer in the media. And we'll be rolling out a series of global capacity building projects which will put tools in the hands of all of our members in over 150 countries so they can do a better job working with governments to develop national cancer control plans, to build on registries, to roll out risk factor projects against tobacco and, for example, obesity. So there's much that can be done, and I would urge you to join UICC to be part of this campaign, because we're looking for together for action, making a difference on the ground with our members in every country. So in time we can say we've had a real impact on the trajectory of cancer. Thank you very much.